Hi everyone, I'm Kristen Presall and welcome to Open Line tonight. Tonight's Open Line is Ask the Dentist, and this is definitely a popular program. We've had it on twice before, and it gives you an opportunity to call in and ask some questions or make a comment about your teeth or somebody in your family. It could be something as simple as talking about a teeth cleaning, or something as maybe a little bit more complex like, do I need a root canal if I've got a crack in my tooth and I feel a little bit of a twinge when I brush my teeth? What does that mean? Am I, basically going to have to knock on your door and get that done soon? So we have two fine dentists who are going to be talking to you about that kind of thing and can answer all of your questions. So if you have a question tonight, we're going to be here until 8 o'clock. You know how this works. All you have to do is pick up the phone and call 737+. And we hope you do that, and soon. I'll go ahead and introduce our guest tonight. We welcome back, of course, Dr. Brandon Sims. He is with Indian Lake Family Dental up in Hendersonville. So nice to have you back.
Thanks.
Dr. Sims, great to see you. And we have tonight Dr. Cameron Mayer, who is new to the program. He is a dentist here in the Nashville area with Allure Dental. So nice to have you on the program as well.
Thank you.
And gentlemen, listen, Halloween was what, last week? So how many fillings have you had in your office? That's what I always want to know. I think to myself, the kids go crazy for the candy, and then what happens? The sticky stuff sets in, and who knows what is going to happen with their mouth in weeks to come. But I tell my kids not so much candy, but they're still, the kids are still snacking on that. As a dentist, in all seriousness, at what point should parents really start considering ease up on candy, or what kind of candy to eat for your kids? What would you all say to that? Either one of you can have an answer to that one.
Go ahead, Cameron. All right. I guess it just depends on the type of candy, whether it's sticky or something crunchy. Of course, we do like to eliminate as much sugar as possible. Sugar is not our teeth best, they're not the best friends for our teeth. So just minimize it as much as possible, and, take it as it comes. Make sure you brush and floss twice a day at least. So especially for the sticky foods, just brush up at hopefully afterwards.
Yeah, right afterwards, hopefully. Because like I said, those kids are, probably eating some things too at school that parents might not know about. So they come home and next visit, all of a sudden, you might have a cavity or something. And that's what you want to try to avoid, especially at a very young age, because that's when it seems to happen the most. That's when that brushing really is so important.
Well, we were, of course, giving out candy on Halloween.
Oh,
and we were all sitting around trading stories about...
Not dental floss, Dr. Sims,
no candy. In fact, my friends were telling me that I should staple my card to all of the
Oh,
pieces
yeah,
of candy.
there you go.
But we were trading stories about what we did with our candy, and the consensus was we piled it all under our bed and then we ate it throughout the year. So maybe it's a good time for parents to go check under your kids' beds, get all the candy out, because that's just money that you're going to have to pay in fillings later down the road. So.
Yeah, and it's nice to like you were talking about too, Cameron, just basically limiting how much that they take in. I mean, obviously a piece here, a piece there is not that bad, but again, fillings happen at such a young age too. You just want to try to avoid that type of thing.
Well, and the thing we worry about too is sugar between meals. So, things that we eat at meal times, the effects on our teeth are much smaller than if we're continually snacking on things between meals.
All right, very good. Talking about fillings, when I was younger, of course, they were the silver fillings, and then they said, there's mercury in that, we're going to stop that. Then there's a porcelain type filling or something like that, the white filling that they do. But then there were some reports at some point months ago saying that might not even be that great of a filling. Is that the case? Are you all using that type of thing? Should anybody be worried about what the dentist is putting in their mouth, or should you ask questions to your dentist? And I'll ask either one of you that.
I think you should definitely ask questions. And I think one of our roles as dentists is to educate people and to make sure that you understand the risks that are involved in whatever procedure that we're doing. So I always encourage people to ask questions. Sure. As far as the fillings go, there was a particular chemical that I would say a couple of years ago got some national headlines that could be contained in white-coated fillings, but the research shows that it's not released after we place the fillings, and most of the fillings don't have that particular chemical anymore.
Yeah, good to know. So, all right, and I'm sure that they always research that and analyze it, and you all are probably seeing new things on the market from time to time too, in terms of what you can use.
There are people who spend their whole careers researching dental fillings, which
that's good to know.
Yeah.
Yeah.
Right.
It's a relief to the consumer, to the patient, because they want, of course, they're relying on you all, their dentist, to be able to give them whatever is the safest and healthiest thing for their teeth. All right, we want to go ahead and go to the phones because I know some of you are going to start calling in, and gentleman is already holding on the line, so we'll get to that phone call, and then I'll continue to ask some questions myself. So let's start with Eric. Hi, Eric.
Hey, how you doing?
Doing great, sir. What's on your mind tonight?
I'm doing okay. I just have a comment. I'm on dialysis, and I have my teeth cleaned constantly every 3 months. Never had a cavity. I'm 53 years old, former Marine. Never had no cavities, no fillings or nothing. I think because when I was younger, my mother and father always had me eating fruits all the time. I didn't hardly eat candy.
That's good.
Ever. So I'm 53 years old. My mother had 2 sets of twins. But my children right now, I just have 3 of them. And I've eliminated the sweets from my daughter's diet. Seriously. Because it's healthy.
Sure.
I mean, it's healthy. And I'm better. I feel great. I try to exercise every other day by being a former Marine. I like staying in shape. That's what I like to do. But I tell anybody that's listening, have your teeth cleaned every 3 months. I guarantee you, you got fresher breath. I smoke sometime every now and then, but I'm not a chain smoker, but I need to quit anyway. But when you have your teeth cleaned, it doesn't hurt. Have your teeth cleaned every 3 months, and it's a lot healthier. I guarantee you. I know what I'm talking about.
All right, Eric. Well, thanks so much for calling in tonight, sir. We appreciate that.
Thank you.
All right. And, you know, he's right. I mean, you want to be able to get into your dentist's office. I've always heard at least twice a year. If you're like Eric and you can go every 3 months, then do it. What would you all recommend in terms of how often someone should get their teeth cleaned?
Well, you know, it all depends on the individual and the overall health of their mouth. Every 3 months is great. However, you know, most people could get away with every 6 months. So in any event, it is extremely important to come and, you know, see a dental professional just to make sure everything is, you know, your teeth are healthy and everything's doing well. And just like Eric, you know, he visits his dentist quite frequently, and it's prevented him from having any cavities. And you know, I want to congratulate him on, you know, his strict diet and routine of avoiding the candies and the sweets. So very good job, Eric.
Yeah, major discipline. That's good. I mean,
Yeah.
you have to do that, and especially when you think of your family, your kids, the whole thing. Speaking of which, we always look at our parents' health for you know, most of our health issues then, whatever we're going to experience when we're older. Should we be doing the same thing in terms of our teeth? Because I look at my parents' teeth and I can kind of tell, you know, even the shape and what our teeth look like, my sisters and mine. It's interesting how some of us have almost identical teeth, but are they going to be the same in terms of composition and what they're like and porous or not, or what is the deal in terms of genetics with teeth?
That's the biggest predictor of whether a kid is going to lose teeth or have cavities. Is really what the mom's experience with cavities or losing teeth is.
Wow.
So I think a big part of it is definitely genetics, but then also a large part of it is lifestyle as well. So it is important to know your folks' history with their teeth and to understand what you're predisposed to having.
Sure.
So if your folks lost their teeth when they're 30, that means that you will not be able to drink the sodas and not visit the dentist and keep your teeth. It doesn't mean you're going to lose your teeth, but it means you have to be, I tell my patients, you got to be the crazy person with floss in your purse or floss in your pocket. Like you really have to take a lot better care of them than the average population if you want to keep them.
Sure, just be extra careful and be mindful of those kind of things. All right, let's go back to the phone lines, gentlemen, because we have another couple viewers calling in, and we'll start off with Barbara. Hi there, Barbara.
Hello.
What's your question tonight, ma'am?
Well, I want to put something to them, and I know most what the answer is going to be, but I'd still like to say it to them.
Okay.
About 13 years ago, I had all of my teeth filled with, it was not porcelain, and caps.
Excuse me.
And right after I did that, I got diabetes. Never had any trouble before, nothing. I was healthy as a horse. And then I got diabetes. Now, talk to me and tell me what you think about that.
And did you know, you said the filling was like a porcelain filling, did you say?
Was not.
Was not. Okay. Was it silver in color?
It was, yes.
It was silver in color. Okay, well, hold on the line, please, because if she had a filling and then a crown over that, obviously it's kind of setting it in place. have you ever heard of anything like that, or any complications for some folks who've suffered any problems health-wise?
There's no research that says that dental fillings or dental crowns or caps would cause diabetes. It is called adult onset diabetes for a reason. So you can have these things develop within your lifetime.
Sure.
So it more than likely is a coincidence that your teeth were fixed and then you discovered that you had diabetes. However, it does bring up an interesting topic, which is diabetes and dental care. And diabetes is very closely related to periodontal disease or gum disease, also with heart disease. So there is a factor in making sure that your teeth are clean and that you don't have gum disease if you have diabetes. And also, too, I won't say a lot, but I have had several patients in the last year that we have been able to send to their doctor to get treated for diabetes because of how their mouth presents.
Wow, that's great. And I know there are a lot of tests that you can do now, with swabbing and things like that, to really find out if there's any kind of other health complications in your future. So we might be able to talk about that kind of thing as well. Ask the dentists and doctors tonight. But we're going to take a short commercial break. If you have a question, obviously pick up the phone, give us a call. 737-PLUS is the number, 737-7587. We will return, so don't go away, folks.